Hello, good afternoon.
Good afternoon, Claudino. He's a PhD both in TCM and Western medicine.
No, in Portugal, I am not a PhD. I am a PhD in acupuncture or Chinese medicine from Nan Jing University.
Okay, very honored this chance to sort of chat about TCM.
Welcome.
Me basically, I'm very interested in TCM, but you are the only person that I've known as a foreign expert on TCM. You are the only one. I've never met anybody else who are so expert on TCM. That's why I'm very honored to have this conversation today. I have a few questions. So the first question, based on your expert, what or what are the key differences between TCM and Western medicine?
Basically, you can resume in two or three things. The first is the philosophical behind the Chinese medicine. The second is the holistic point of view of the health. And the third is the adequate. We have a thing in Chinese medicine called syndrome differentiation. And this syndrome differentiation.
Oh, syndrome.
And this syndrome differentiation gives the difference when you look to a disease. Just to give you an example, we have diabetes. Okay.
Yeah, diabetes.
Diabetes in Western medicine is diabetes is the name.
Right.
In Chinese medicine, we have a lot of differentiations according to the disease, according to the manifestations.
You mean the symptoms?
Not only the symptoms, but the location of disease. Okay? So the disease is a process that starts and develops. Okay? During this moment, there are some symptoms, some location, some fights between what we call Jing Qi and Qie Qi in Chinese medicine. This is a big difference, is to adequate the treatment to the person.
Okay.
We have disease, but we also have patients.
Okay.
Not only disease, not only patients. There are disease and patients. Okay? We have to look to the patients in different ways concerning to the Chinese concept. What is the moment of disease the patient arrived to me?
Oh, okay. From in terms of a TCM treatment, it's quite different from.
It must be adequated with the syndrome differentiation.
Yeah. Okay. So that means, in some extent, TCM potentially preventing the disease from further development.
We have to say that Chinese medicine should be understood as a preventive medicine, but it's not only true, because Chinese medicine can do prevention and different kinds of prevention, what we call primary prevention. Okay, what means primary prevention? Before the disease to be onset, you catch. You must prevent by using techniques of massage, tuina, qigong, tai chi, moxibustion, acupuncture, Chinese dietetics, these kind of things. Okay, what we call the lifestyles to keep qi, chen, and jing. Okay,
qi,
chen, and jing.
Jing, Jing and yes.
Jing and chen, Chen is two parts. Chen is some people look to the soul, but Chen is the manifestation of the healthy. You catch? Is the correct state of health. This is Chen. Chen is also related with the mind. We have two kinds of in a wide and a narrow sense. When you're talking the wide sense, involve all these aspects of health, the brightness of the eyes, the skin, the brightening of skin, the harmony of the movements, the way you speak, all this is related with Chen. In a wide. In a narrow, it's related with the mind.
you are expert on acupuncture. I understand you do acupuncture to your patients too. What are the most popular or effective acupoints?
The way I use acupuncture is not related with what we call point protocols. There is pre-defined. You can go to a book, and it's very interesting because some years I see people that buy books and they believe they can do acupuncture. So we have different ways to choose the points. Okay. But nowadays, and when you arrive to a kind of level, you start to look more to the importance of the body of the patient, to take attention for the deformation, the disharmony between the parts of the body. Okay. Otherwise, you can use some very common points. It's true, points concerning with the disease, concerning with the syndrome differentiation, concerning to symptoms. Okay, this is the method to do. You have local points to treat. You have distal points. We have points related with some organs and some disease.
Yes. In China, you must know this. 五脏六腑 is 5 viscerals and 6 what they call it, balls, right? 五脏六腑. That's right. So
the manifestation of the 5 organs and 6 viscera.
That's right. Right. So usually, I noticed that Dr. Liu, she's using very different way of doing acupuncture that I've never done. I've never been treated like that. So yours is, yours is...
I'm not this kind of theory of Wuqing.
Oh, really?
The Wuqing theory, no. Wuqing theory for me is a little bit limited. You must go around, because for me, I'm an acupuncturist. The most important for a acupuncturist is the meridians. Jingguo Mai.
Oh, okay.
This is the most important, okay? I also pay attention to the 5 organs and to the 6 viscera, Zheng Fu. The 5 Zheng and the 6 Fu.
Yes.
There are some theories based on this, and there is people that only do this, but this is a very limited part of acupuncture. I cannot believe we can do everything through that.
Nothing can.
That's why we use more the meridian theory. It's the most important, Wuqing is very important. Zhangqiang is very important for TCM. Zhangqiang, the manifestation of Zhangfu. Zhangqiang. The manifestation is very important to Chinese medicine. Is the core, if you want to say. This is the core of differentiation. But for acupuncture, the core is meridian theory. Okay? So we pay attention to Zhangqiang, the manifestations, but also to the meridians. And what we do nowadays, at our clinic, is not to looking for, let me see what is the organ. No, let's see where is the blockage. Where is the stasis or the stagnation? Why the blood? Because mainly disease is based on 2 things. Is the flow of qi and chui.
Yes, flow. I do believe that.
The 100%. Flow, if the flow of qi and chui is blocked for some reason, disease appears. And this is caused with imbalance of yin and yang. That's what is called disease. What is called disease in Chinese medicine is disease. The disease is the imbalance of yin and yang. And this imbalance results in something that is related with what? The flow of qi, chui, and the liquid the fluids, the body fluids.
Yes.
Okay? So, if you understand your body, if you can look to observe from the pulse, from the tongue, from the palpation of the body, you can understand where is the problem, why qi and chui is not flowing.
Yes.
So after this, you must find the points to try to make it move,
Yes.
make it circulate. Okay,
right,
this is
exactly.
important. For example, if you want to use what most of people do, there are a group of points that are normally used for liver qi stagnation.
Yeah.
Okay. People say is gallbladder 34, is spleen 6, stomach 36, liver 3 or liver 2.
Yeah.
They do this kind of things for us. Okay, this is very interesting, but we want to understand more. We are not used. This don't means we don't use this point, because sometimes we use those points. Okay. For example, cilial, people who can use the points in the sacral. It's called the balial, cilial, balial. The point that is there, we can use, but sometimes the application to us is different from what people commonly do.
Oh, okay. Some people believe that in our body we have air floating in our body. Do you believe that? We
have everything in our body flowing. For sure, we have. That's why sometimes you have some to call that air. Yes, we can have. Everybody say that they have gas. Okay, aerogastria. Okay, it's true, but these concepts go more to the problem qi.
Oh, qi. Okay.
For me, is that what people want to say, but it's true. That is true. That air also circles. Is the body fluid? Is the hair? Is qi? But this qi and hair, I don't know where it is.
Okay.
Shui is another thing. Shui is another thing. Shui, the blood. Is another thing. You catch? So this is more. But it's true. When you have we can say, for example, you have abdominal distension. Okay.
What is that word again?
Abdominal distension or dilatation, distension. This is qi or is air? Well, because sometimes there is no really air. Sometimes it's more, there is another thing. That's why sometimes I make a distinction between distension and dilatation. Dilatation probably is the hair. Distension is another thing.
Following your explanation, I would ask, fart or burp are the good things or the bad things?
I didn't catch you.
Burp, like you eat food and then you burp, right? The burp is a air or is like a fart. You fart, right?
It depends. It depends. What you were talking about, feng pi and
that's right. Okay. So
Chinese used to say feng pi is the qi of the body.
That's true.
That's true. Okay. What is this? Is this good or is this bad?
Yes.
It could be a manifestation of good and bad. Okay. Good when you start to be alleviated. Something, so you need to expel outside.
Yes.
Bad when you continue producing, okay, in this. So, and another thing, the smell of this, can show you something related with what is happening inside of your body. So if there is a lot of things, food stagnation, a lot of things, problems of infections, of infections or things like that. But sometimes it's because you eat too much. Okay, and that is the way to your body to send away to So we cannot say that something is good or it's bad. The good and bad is based on limitation. Balance, limitations. This is Chinese medicine, you catch? Perfect. Chinese medicine is limitations. But the biggest problem is the limitations is not for everybody. You must understand your limitations. Your limitations is different from my limitation. Okay?
Sometimes you need an expert to tell you your limitations.
It's very difficult to say. Very difficult. I used to say we need to understand our body.
Yes.
The main problem is when we start to learn about our body, we already have a lot of vice. So it's not the body that is talking, it's the vice of the body that are talking. It's the brain, you get?
Yeah.
When someone tell you my blood needs chocolate, that's incredible. How could your blood like chocolate? But it's true. It's true. There is kind of dependence that we have. Mostly it could be physicals, but some of them could be from the mind.
That's
You
right.
depend on
That's
that.
right.
Okay.
So interesting that you mentioned that, because sometimes, according to Chinese, okay, if someone telling you, oh no, not someone telling you, yourself, your soul crave for meat, like those delicious meat, right?
Mm-hmm.
That means you are healthy, like you want it. Because sometimes if you have a liver problems, when you see meat, you feel, oh, I want to throw up, right?
Mm-hmm.
That's also some sort of a, you know.
If, as I told you, limitations is a thing. You have to eat everything. There's nothing good, nothing bad, nothing, you know.
I know.
Okay, I know people that is vegan and they have cancer. I know people that smoke, drink, and are healthy, arrive to 120 years.
I know.
Okay,
Yeah, that's what I want to ask. Why it's like that?
What happened here is, if you understand your body, if you know to use the things, your lifestyle, your food, etc., your life will be different. Even like that, we never know. Yeah. I know people they said to be very healthy, they always, and suddenly they catch a cancer. And they say, why? You know, why so many autoimmune disease in this world? Autoimmune disease. There is a lot of autoimmune disease, including, how to say, for example, lupus disease, rheumatic disease. Okay, even nowadays we have a lot of skin disease that are considered as autoimmune disease. Why?
Why?
Because our autoimmune means our defense is against us. What is the main cause of this? At this moment, we cannot say different theories. You know, there are theories that are related with the fact that you take vaccinations. There are theories that you don't pay attention and you are constantly infected by virus, bacteria, and things like that. So you are asking something too much to your body. And there is another part that is and this part is very important, is your mind, your emotional imbalance. When you are in emotional imbalance, for example, you've got a depression, your system become more low, more deficient.
Yeah, that's
okay?
True.
And there is some theory nowadays that say that sometimes when you cause these kind of conflicts between yourself, you are promoting your body to react against you. It's a way.
Yeah, wow.
I don't know who is right. I accept all these theories, but to me, the most important is to understand, people to understand a wall. You know, it's don't to forget that, it's the liver. No, it's not the liver, you know. For example, there are problems of diabetes has nothing to do with the liver.
I know.
Okay.
Is that about sugar? Too much chocolate.
Yeah. For Chinese medicine, it's divided into 3 jiao. The upper, the upper, middle, and low, according to the symptoms. Okay. And this probably in some case the most problem in the diabetes is what we call the heat in the stomach. Someone has the lung deficient in.
So interesting. You see this circle?
Yes.
Okay. So is liver? No, that's a liver.
No.
Starting from liver.
Okay. We get used to put liver here, and this is
that's right. So liver, heart, right? And this is a spleen. And
lung,
this is it's lung,
patient.
and then that's a kidney. That's right.
Yeah.
So
P.
this is very, very interrelated, right?
Let me see. Chinese medicine always look to the nature.
To
Okay?
the
Nature.
okay.
Natural world.
Okay, yeah.
The natural world.
Yeah.
So what happened when you talk about Zhenjiang? You must be related with Wuqing.
Yes.
Wuqing is the 5 elements.
Yes.
And for Chinese, the most important is the 5 elements of nature.
Yes.
That they are related
Yeah, they're all
between them, okay? That some generate the others.
Yes.
But at the same time, everything that generate cannot be indefinite
Yes.
generate.
Yes.
So in Wuqing, we have also the domination relation. I mean,
Yes.
that to control.
Yes.
That's,
Yes.
for example,
yes.
you can see when you show that,
Yeah,
you
it's
see
all control.
this circle is the
Yes.
generation,
That's
and
right.
this is the domination.
That's right.
Okay?
That's exactly.
So this is very important to understand this.
Exactly.
Okay, because
What-
it's the base. But later on, people start to look for the characteristics of the different organs to adapt to the different elements. This is the way appear the 5 Zhang related with Wuqing. Okay? Why? Wood. What is the property of wood? Why liver is related to it? Okay?
I know.
Art is the fire.
Yeah.
So why art is the fire? Because they understand that the heart is the fire of life. Okay?
Yeah. Yeah.
The water in kidney. So this generation, okay, according also to the different, how to say, the spring, summer, etc.,
I
etc.
know. Yeah, those are more complicated.
The seasons of the
Yeah, I
season,
know.
the seasons.
Yeah.
So they become to understand all these relations, and when you start to go there, you have a lot of things to see. And this is the normal part we study, because there is a lot of things that we have no Western, we don't have
No.
bibliography. Yes,
No.
there's a lot of things, and sometimes we have some books that arrive to Western people that time.
Not to the really
Don't
deep,
go
deep
there.
enough.
Enough.
Not deep enough. I
Not
noticed that.
just, and sometimes a lot of mistakes.
Why don't you write something?
No, I have no. At this moment, I have no patience for that.
Okay.
Yes.
Once you are fully retired, like me, you can do that. Okay.
I used to be at Western. I used to study Western medicine. Later on, I went to Chinese medicine. You know?
Yeah. So why do you?
Because
This
I
is a
need
big
something.
switch.
No, because I look for something. I look for something that can help me, my patients.
Okay.
You know, because we are very good at surgery, etc., etc., etc. You understand?
Yes. Yeah.
But there is some things we cannot do more.
Yeah.
Chinese medicine give me another opportunity to look
The option.
another way to look the body of the patients,
Okay.
and the different things that help me to help them. I stopped to study Western medicine, and
Yeah.
immediately I stay some time
Okay.
in the emergency. But
Okay.
later on, I went to looking for
Something different.
something different,
Okay.
and later I found the Chinese medicine.
Okay.
In the beginning, I have a lot of problems because when people talk about this is a disease of liver, or this is a disease of spleen. What spleen, you know?
Yeah,
So I have to destroy all my way of thinking to get into the Chinese thinking.
Okay.
Nowadays, I can try to make some relations between the Western and the
yeah.
Chinese.
So that's why I'm so interested and impressed that you cross these two different, very different fields, right? This is very helpful for either Chinese to understand better, or the Western, both, right? So that's gonna be very helpful for them, for you to explain that.
Sometimes, yes, it's
Yeah.
necessary. Sometimes it's not easy to. There is not easy to explain, you know.
I
And
know.
nowadays, diseases are not anymore. Even in Western medicine, We used to have this is very, how to say, this is this. And nowadays, when I see how to say, the diagnosis of some Western doctors become very complicated.
Yes,
it's not easy. It's not easy at all.
I'll agree.
Not easy at all, because there is a mix of symptoms. There is a mix of disease. They don't exist only, You see, the problem that scare me at this moment is the consequence of this pandemic, because these people is going to pay for this.
I have very, very strong side effects. I've done a lot of videos on my channel.
Yeah.
But the key is, to me, because I've been living in Canada for 20 years, and to my understanding, the Western doctor basically just waiting for until you're almost one of your organs is rotten and they need a surgery, right? And then the Western doctor
That's why I told you. Concerning about surgery, incredible. Nowadays, with some techniques in chemotherapy, things like that, radiotherapy, okay. But I have the conscience that the doctors do their best concerning to their knowledge at that moment. No one, I don't believe, you catch? I don't believe the doctors will not do the best, know. I'm lucky to have a lot of friends from Western medicine, some colleagues, and I have admiration for them. I admire them, because it's very important for them. But I believe the most important thing is that we can work together.
Yes, I think that's
the most important is the best for the patient, and the best for the patient is sometimes to have cooperation between the two.
Exactly.
Knowledge.
I fully agree with that.
Because I have some patients that come to me sent by medical doctors. The same way I send some patients to medical doctors. I don't like to see the patient suffer, you catch? Just because I say I'm the best. No. If I'm able to look to the patient and I see that he has a cancer, I'm not going to tell you, no, I can take you, I can take you and help you to. No, I will send to the medical doctor, and then I will say, I will be here to help you, to support all the treatments you have to do, try to reinforce your things. Okay.
Thank you very much for answering all my questions. So the last question, but not the least, in the future I'm gonna do more videos. As a doctor, what's your really mission?
Help people.
Just
help people in all the sense. Once I pass in Porto, I pass in the street and there is a boy that say hello to me and ask me, "Hey, hi, doctor, you remember me?" I said, "Yeah, your face is not strange." And he told me, "Doctor, you are the only one that helped my mother when everybody abandoned her in the end of her life. And during some times, I try to help people to have a quality of death. Not by killing them, but to try to give them chi to them to continue to live or die. Because sometimes you need chi to die."
Yes.
During a long time, I dedicate myself to what is the terminal care patients. And this was, I learned that. And as I am a clinical patient, I always feel what is the problem of patients.
Thank you very much.
Welcome.